You know what happened is he was supposed to toss back to me, but he
Nice
looked
job,
impromptu
Jim.
and he saw Carl.
Nice job.
So.
You definitely you got under his skin, Jim. We like that.
Work.
I just cannot win with Joe. I can't win. I can't win.
There is no winning.
See you later.
Put
See you later,
those
Goldman.
hopes aside.
Go away.
That Google News on any other day would be a lead for us, but the health care vote, obviously the lead today, getting the votes it needed to pass. Not without plenty of debate and wrangling by the White House to get those last yays. Joining us this morning with more on the vote, Congresswoman Debbie Wasserman Schultz, Chief Deputy Whip, Member of Appropriations, and Congressman Charles Boustany, Member of Ways and Means. It's great having you both. Do you feel like you've run a marathon? Do you want a Mylar blanket put over you? What's it like?
You know what? This has been a marathon, not a sprint, and we've got a few steps to go until the finish line. So it's an incredibly amazing feeling knowing that we've finally gotten the Senate bill into law. The president will sign it, cover 32 million Americans with deficit reduction, but by $143 billion, slow the growth of Medicare, and add 9 years of solvency.
Yep.
The American people really won last night.
Is it time for a reset? Are we capable of having a reset in Congress?
Well, Carl, I think if we look at this, we know we have a long way to go. I believe there are going to be a lot of unintended consequences from this massive bill. Of course, we all know about the major tax increases across the board in the face of a recession that are going to hit businesses pretty hard. But I'm very concerned about the long-term fiscal outlook as a result of this bill. The Congressional Budget Office gave us preliminary figures, but in something so complex as this, it's really hard to get accurate projections. And that's why Republicans felt that we should go step by step, break it down into workable parts with an eye toward getting toward a comprehensive solution.
The incrementalism debate, I wonder if you think that's been settled.
Step by step was shorthand for do nothing. The Republicans, during the 12 years they were in charge of Congress and the entire government, didn't make health care reform a priority. We did, and look, with all due respect to my friend Dr. Boustany, just because he says it doesn't make it true, this legislation will provide the largest tax credit, the largest tax cut for small businesses in history, up to 50% of reductions in their premiums when they provide insurance coverage to their employees, $143 billion in deficit reduction. The CBO numbers were solid. They don't put them out and have them be on.
But his point is,
ground.
it's going to be up to future Congresses to make sure that the numbers stick. Yes.
Of course, it always is. But just in this calendar year, we have really significant reform that Americans are going to feel. Insurance company abusive practices will end. Children will no longer have to be denied coverage or dropped because of a pre-existing condition. The donut hole for senior citizens will begin to be closed and will be fully closed over the next 10 years, and a lot of other really important reforms that the Republicans, with all due respect, just had no interest in making.
We know Congressman DeMint's going to introduce some legislation to repeal it this week. Are those hopes unfounded? Anyone waking up this morning thinking there's still hope that this doesn't happen? Are they dreaming?
This is going to become law, and I will spend the rest of my congressional career trying to undo some of the problems with this bill and trying to deal with it. There are going to be problems.
Do you think it's fixable in that Republicans can find ways to operate within the context of the broader bill that's been passed?
We're going to have to take on these unintended consequences and problems and deal with them as we go. I'm convinced as a doctor, not taking that 30,000-foot level, but at the clinical level, with all the experience I've had, I think we're going to see some serious consequences clinically. We already have shortages of doctors and nurses. This is not adequately addressed. Quality as a whole is not addressed in this bill, and I see serious cost issues going forward, Carl. It really is going to be a problem. Keep in mind that the Congressional Budget Office certainly did not add in the doctor fix in this. We've got double counting with regard to the Class Act, which is a new long-term care entitlement that's been created. I think it's on faulty footing, and so these are issues we will have to address going forward.
Let me ask you one thing, just on politics. Here's Peggy Noonan writing on Friday before any of this happened. She wrote, "I wonder at what point the administration will realize it wasn't worth it. Worth the discord, worth the diminution in popularity and prestige, worth the deepening of the Great Divide. What has been lost is so vivid, what has been gained so amorphous, blurry, and likely illusory." Are Democrats going to have to pay a price, even a price that they're willing to pay?
I think we should ask David Frum, President Bush's former speechwriter, that question, who wrote an essay yesterday that was published and widely distributed that said that the only Waterloo that that anyone is going to have to deal with are the Republicans, because the significant reform that we've accomplished, the fact that we put patients and their doctors back in the driver's seat and not insurance companies, the fact that we're really aggressively addressing the deficit, at the end of the day, consumers are going to realize that this was a really good thing to do. And to be honest with you, I dare the Republicans to repeal this, because this is significant reform that the American people are not going to want to give up over the next few months when we're able to talk to them about what we've done.
All right. Is that a dare? Does that send chills up your spine? I mean, attorney generals who are filing suit, should they be bolstered by that comment, that dare?
Carl, we could have done better. I tried from the very beginning to make a bipartisan effort in this, and with my background in health care, I did reach across the aisle. We tried to get some common sense activity going back and forth, and it just didn't happen. And what we have now is a partisan, complex bill. There was bipartisan opposition to the bill, unanimous Republican opposition to the bill, but we had a number of Democrats who were opposed as well. I believe we're going to spend a lot of time, my entire congressional career going forward, trying to deal with some of the unintended consequences of this.
Right.
Look, the American people watched President Obama and the Democratic leadership reach out over and over across the aisle to try to get Republicans to come to the table and sit down and reach bipartisan compromise. That's exactly, again, what David Frum said, is they had an opportunity, they blew the opportunity, and so instead we move forward with the reform that we know is going to make sure that we can put patients and doctors back in control of health care, actually in control, which they've never had, and make sure that we can reduce the deficit and add solvency to Medicare.
Last question. Does it embolden the Democrats to swing for the fences on other things, too, because you were able to get this done?
No. What we were emboldened by the election in November of 2008, when the voters elected Barack Obama President of the United States, urged us to move this country in a new direction, and voted for change. And that's where we're going to continue to press forward for.
All right, we'll see. It's going to be an interesting few months into November. Good to see both of you. Thank you for your time. Congresswoman Wasserman Schultz and Boustany. We're going to take a next from one overhaul to another. Senator Bob Corker on the latest changes and fixes we can possibly see in the financial regulatory reform bill getting marked up tonight, 5 o'clock Eastern. Squawk Box continues in just a moment.
The stock of the day is on the way. Is it in your portfolio? Find